All right, when I was preparing this talk, I realized that in the rural setting, what does that actually mean? I'm not going to be talking about like level 3 or level 4 trauma centers. I'm talking more about kind of in the wilderness or kind of more wilderness environments where you don't have access to definitive care. Oops. Is this able to advance? Perfect. So I have no disclosures. Again, the definition of wilderness medicine, there actually is a definition, there is an organization dedicated to this. It's the practice of medicine where definitive access to care is greater than an hour away or in austere locations. Overview of the talk, we're going to talk about pre-travel arrangements. This is key to wilderness medicine and survival. If you're going to survive an accident or trauma in a rural setting or wilderness setting, it's because you've made some type of pre-travel arrangements. We'll talk about gear, stabilization of injuries, optimization of those injuries in your care, and then resources and your overall objectives and goals. So part of the pre-planning, know before you go. This literally takes maybe 5 minutes of time to just know where you're going, know the terrain. You can look up on Google, your cell phone. We'll be able to give you all this information immediately, right? What the weather conditions are, what you could be facing. In Iowa, where I grew up, once it became wintertime, I always put in emergency like jumper in the back of my car, water, blankets, just because the weather is so harsh in Iowa during the winter season. It's nice to have something kind of prearranged. Where's your closest help? If you run into problems, what's the closest town you may be able to find? You should have that available to you before going out to those wilderness environments, because you won't be able to rely on technology. You won't be able to rely on cell phones. And then any endemic hazards, like we have rattlesnakes out here. So part of pre-planning, tell someone, more than one person, and then Facebook doesn't count. My mom does this to me all the time. She'll be like, oh, I just came back from Mexico. I was there for like a week, and I was like, you didn't tell me you were going. And she's like, oh, I posted on Facebook. I don't have Facebook, so I never know, what she's doing or what she's up to. You want to know your route and your destination. So even if it's just for Thanksgiving and you're traveling up to Page, tell someone what time you're leaving, what the route is that you're going on, because if you don't make it in a certain amount of time, it's easier to kind of know where to look for help for you. And this is very important in snowy conditions. Happens all the time in the Midwest. You could roll off the highway off an embankment and get covered in snow overnight, and no one will be able to know where you're at. Again, what's your expected return time? What communication devices will you have? Is it cell phones? Again, cell reception, even though it's 2017, isn't great in a lot of these wilderness areas. And then know who you're traveling with and expectations are. Most people here at this conference is some type of healthcare provider. If you're traveling with people who aren't healthcare providers, they're going to turn towards you to maybe provide help in traumatic injuries or traumatic settings. I threw this one in here just to let you know there's a lot of research in this area in austere locations and wilderness trauma. This is a burn care in disaster and other austere settings. The reason why I included this in here, as you can see, is they're using oral resuscitation formulas for burn care, but that's only if they're pre-arranged or pre-planned, or the thought that you could do that is in place. Otherwise, it makes no sense to have those types of papers or those types of resources. So this is pre-planning, and they're doing a lot of data with this in place. So what to think about overall, so you have difficult patient access. So if you are a patient yourself, you want to go out hiking in Red Rock Canyon or up in Page at Antelope Canyon, or by yourself, just remember it can be difficult for people to locate you with limited equipment and limited resources. How about gadgets and gizmos, what to bring along? I think GPS is really phenomenal. The technology is really cool, and it's becoming a lot more readily available for personal devices, and we'll get to that in just a moment. Same way with clothing. You could give an entire hour lecture just on the advancement in clothing technology. Again, I have no disclosures. I'm not sponsored by REI, but if you go to REI's website, they have a ton of quick links just on clothing. You don't have to buy it from them, but you can do some research on it yourself. Water filtration, are you going to bring water with you? Is there water in your car? Or are you going to have to filter some? And then gears and kits. There's pre-made kits on the internet for both survival and first aid. And then do a little bit of research. Functionality of the equipment you're bringing. In the picture in the far bottom right, you can see those big heavy packs. Do you need all that equipment? How long are you going out for? And then what do you need? Communication basics. So again, don't rely on cell phones in the wilderness or rural settings. You may not have cell towers. Two-way radios are great. Those are just walkie-talkies, easy way to communicate. Satellite phones, a little overkill unless you're going out for an extended period of time. A whistle is very simple, right? Say you're out hiking by yourself and you break or twist an ankle, you can't walk, or you break a leg and you fall and you can't get up. You know, how long can you yell for? You're gonna run out of resources between your voice getting hoarse. A whistle is very simple, right? It takes no battery power, just your own voice to be able to use it. A signal mirror, not only to make sure that you look good as you're out there traveling, but to signal for help from far away distances. And then can you build a fire, right? Are you gonna spend, 4 or 5 hours like on Castaway trying to whittle a little stick? Or do you have a little device that, can spark and start a fire, or those matches, strike anywhere matches? And then bright clothing. GPS, again, global positioning system. A lot of people don't realize that the military actually owns and operates this and makes it commercially available to us for free. But at any point in time, they can take that technology away from us. It's really interesting, just a quick point here, the way they developed this is Sputnik was put out into space. We were worried about what radio signals that the Russians were sending, so we started to try to locate the signals of these signals that they were sending to Russia. And what we realized is different areas in the United States could pinpoint the satellite. So some physicists decided to reverse that formula. So instead of us triangulating the satellite, they put satellites to triangulate us on Earth. To give you an idea, on this slide, the United States runs about 36 satellites at all times around the Earth to global positioning, but other countries do the same thing for their people and for their military. With GPS, there's also EPIRB. It's emergency position indication radio beacons. So this is on a lot of boats and planes, but now they make it commercially available. It can be about the size of this clicker. When you buy it, you register onto the internet, all your personal data, your information, where you're traveling, any health conditions. We just had those 2 people that were lost at sea for 5 months, right? They had one of these. Unfortunately, they didn't activate it. In 1982, 44 countries got together, and together there's an international satellite system that runs this. The way it works is if you activate your EPIRB in the United States, it goes to a GPS satellite to find you. It also goes to rescue satellites in 44 other countries that also run satellites in orbit to help locate you. So there really is no search and rescue anymore. It's just rescue if you have one of these and you activate it. So I mentioned clothing. It's lighter, more comfortable, easy to carry, insulated. Do your homework, easy just to Google or Yahoo or whatever your internet choice is to look things up. You can listen to podcasts or just ask friends what they use or what they bring. So now you're out in the wilderness, you're out in the rural environment, and you come across a trauma or yourself is a trauma. What do? You really want to try to stay calm, right? It's hard to do that if you're out there. But you have to assess scene safety. We talked about kind of these mass casualties, right? If you're mauled by a bear or stung by bees or any other type of endemic hazards, you have to make sure that the scene is safe before you go in to try to rescue somebody. Think first and then act. And then observe the terrain, the time of day, the weather conditions, right? If you're out there in the middle of July and it's 120 degrees out in the daytime and it's nighttime, do you need to get access immediately? Do you need to find help immediately before the daytime rolls around, it's 120 degrees out? Just kind of things to think about. We'll talk about kind of the ABCs. Is the airway patent, right? So if they're conscious, are they talking? That's great. If they're unconscious, are they breathing, right? And if they're breathing, does it sound normal? So you're out there in the wilderness, you have this cool keychain device, you're going to emergency crike somebody who's not breathing, but then what are you going to do, right? That's the problem in the wilderness setting. So you got the cool skills to crike somebody, you do it. Now you're going to stay with them and blow through that little device, or did you bring a whole kit with you to like bag, mask, valve them, right? So it's cool that they have these devices, but are they really useful in a wilderness or rural setting? Something to really think about. In mass casualty situations, what they train and teach you is that if you're not breathing and you're unconscious, if you do a chin lift and jaw thrust or you pull the tongue out and there isn't breathing, then technically they're dead. So how about Cspine precautions, right? Is there a reason to suspect injury? If you're out in the wilderness environment and you have to maintain Cspine precautions, and one, how to do that, and then ultimately, what does that mean for the patient, right? So if you're going to maintain C-spine precautions, as you see in that bottom picture, how are you going to get the person out of there, out of that location safely, right? So you can try to clear their C-spine without C-scans, right, or CT scans, either Canadian C-spine study or the Nexus criteria, right? Are they alert and oriented? Do they have, and what's the mechanism of injury? Do they have any tenderness? But you really want to try to clear their C-spine. So ABCDs, we're still talking about that. You want to stay calm, cool, collected, look and listen. You may not have a stethoscope, but you can put their ear to their chest and listen, right? Something that's going to kill them, say they fell 10 feet, 20 feet, and they have broken ribs and they have a tension pneumothorax. How are you going to treat that? You know, is there a way to needle decompress them, or are you going to have to insert, a knife into their chest to decompress them? Something to think about. But a tension pneumothorax will kill someone, out in the wilderness. How are you going to decompress it? If you have, a needle ahead of time in some type of survival kit, you'll be able to decompress them. The flail or the open pneumothorax, there was a video I had, but it was a little bit too long, but it showed these soldiers. This guy was stabbed in the chest. They came upon him, and it was a sucking air wound, and they had a credit card, and they basically tape it to his chest, and it acts like a one-way flutter valve. So there are some creative ways to treat chest trauma out in the rural environment. Circulation. So we mentioned earlier, 80% of trauma victims in a level 1 trauma center die because of bleeding. So you can imagine in a rural setting, it's 5 liters per minute. You need to stop, cardiac output's 5 liters per minute. You need to stop the bleeding. So you need to expose, provide direct pressure, and then tourniquet if possible. If they're not bleeding with some other cause, they may be hypotensive, tachycardic, or in shock. Maybe it's hyperthermia or hypothermia, so you either want to warm them up or cool them down. Maybe it's exposure to some toxins you weren't aware of, a snake bite, rattlesnake, scorpion, bees, plants. Maybe you didn't know they had asthma and it's an exacerbation of their asthmatic conditions. Maybe they had a heart attack. They weren't prepared for the hike that you went on with them. Just different things to kind of think about if they're not bleeding to death. And then extremity injuries or pelvic injuries, is it stable or unstable? The reason why you want to know that is it's pretty cool. It's kind of dark, but you've got some tree limbs and you've stabilized the extremity, but what does that mean for that patient? Right? How are they going to get out of that region now? Or have you just immobilized them and incapacitated them by stabilizing their fracture? So how are you going to survive, or how are you going to stabilize that injury? Tourniquets, we used to think in level 1 trauma centers, we used to be kind of mad when EMS put tourniquets on, and the first thing we do is take tourniquets off. We used to kind of yell at them, but data shows time and time again in both military traumas and level 1 trauma centers that you can apply tourniquets safely to save a life over a limb, especially in a rural environment. You will save someone's life by applying a tourniquet. And then seek assistance. What are you going to do? Luckily, in the big picture there, they have a lot of people there to help litter carry that patient out of there. But say you're in the bottom and you're in the forest, or you're in some type of location where it's going to take a lot of resources to extract someone. Are you going to have to leave someone behind and go get help? That's part of the planning phase of kind of wilderness medicine. Conclusion, again, this is just a 10-minute quick fire session, but there's no excuse. Do a little homework before you go out there. Communicate beforehand. Try to stay calm. If this topic interests you, just like advanced trauma life support, there is an advanced wilderness life support course you can take where you actually go out and hike and you come across trauma scenarios or medicine scenarios, and you can go to these different websites to look them up. And this is all kind of free information on the internet. Thank you for your time.